Hi, everyone. I'm interviewing Kim Burks for parent-child interaction therapy. Kim, you want to go ahead and tell us a little bit about yourself?
Hi everyone, I'm Kim and I am a licensed marriage and family therapist, and I've been licensed for 4 years as of today. And I am in private practice in Hanford. I'm also doing some contract work in Visalia as a PCIT trainer, and also starting to do some contract work in Hanford at Champions Recovery, starting up a PCIT program.
Perfect. Kim, we appreciate you being here with us today, taking some time out of your day to be able to help us out and drop some knowledge on us. So thank you so much.
Thank you.
So let's just go ahead and get started. I don't want to take too much of your time today. First of all, what is PCIT exactly?
PCIT stands for Parent-Child Interaction Therapy, and it is a type of treatment for children between the ages of 2 and 8 and their caregivers. Typically, we see children who have some behavioral problems, tantrums, defiance, swearing, sassing, and parents who have a really difficult time managing these behaviors. And so parents will contact us and, they're looking for help. And so we meet with them and then determine if PCIT will be a good fit for them or not. And then we go ahead and get started.
Yeah, a lot of, we actually are running a reactive attachment disorder class this week. And a lot of what we found in our research was that PCIT was one of the leading treatment opportunities for children and parents with reactive attachment. Can you take us through kind of the process and what does the assessment maybe look like from the beginning?
Sure. PCIT, it's an evidence-based practice. So basically everything is, we collect baseline information and then we're looking to see progress. So we collect information pre-treatment, mid-treatment, and post-treatment. So an assessment would basically, we would get the parents or the caregivers report as to the child's functioning and what's really going on with the child. And then we would do an observation session of the parent and the child in the playroom playing together. And so sometimes we're able to see, sometimes the parent and the child get along great in that first session. And sometimes we see the child, maybe doesn't want to follow the rules or doesn't want to put the toys away. And so we collect information to see what really we can work on with the parent and child. So that's the assessment. Once we determine that PCIT would be a good fit, then we move into the first phase of treatment. And the first phase of treatment is relationship enhancement. So we're working to really build that bond, strengthen that attachment. And so we're focusing on all of the child's positive behaviors. In this phase, we are doing our best to ignore the negative behaviors because typically the child is used to getting attention for their negative behaviors. Right. So we kind of switch it up on them a little bit.
Yeah.
So in this phase, we use what's called the pride skills. So P stands for praise. We're going to praise all of their great behaviors. R stands for reflection. We're going to reflect all of their appropriate behaviors. I stands for imitate. So we're going to imitate their appropriate behaviors. D is describe. We're going to describe all of the appropriate behaviors that the child is doing. And E is enjoy. So the parent and the child get to come in and enjoy 45, 50 minutes of playtime where there's no other kids. It's just the parent and the child. The cell phone is turned off. And so the child has that one-on-one attention with their caregiver.
Nice. And that's a useful acronym for us to kind of take home with us too. How successful do you usually see it be? Like, are there a lot of people who walk out with success after PCIT?
Yes, and I always tell the parents what you put into it is what you're going to get out of it. So in PCIT, we meet with the parent and the child once a week. There's also homework involved in PCIT. So it's 5 minutes a night practicing those pride skills during a play session with the child. And so if the parent, is practicing, PCIT is kind of like learning a new language. We're teaching a different way of speaking to your child. And so, the more you practice, the more natural you're going to feel in speaking this PCIT language.
Yeah, and I've seen too. They have the glass, and where they're kind of being coached in PCIT. Is that kind of intimidating for the parent from what they tell you?
Some parents in the beginning, yes, they're very intimidated by it because they know that, someone's on the other side of the room watching them. It's also being video recorded, and the video recording is for training purposes only. And so it can be intimidating in the beginning, but the parents really just kind of warm up, and they know that the PCIT therapist is there to help them and to work with
them. Okay. Well, Kim, we definitely appreciate your time today. I told you I'd keep it short and sweet. Can you just give out your contact information for us, just in case somebody wants to get a hold of you?
Sure. My private practice is located in Hanford, and my office number is 585-1898, extension number 2. And we also have PCIT that we're starting in Hanford at Champions Recovery. And their phone number is, I'm going to look this up here, 772-8144.
Okay. I appreciate you giving us that information, and thank you for your time so much. Very useful. And we'll talk to you soon.
Thank you, Isaac.